empirically and in clinical experience, we know that you can't just medicate a personality. It's psychotherapy. That's the treatment of choice for problems in your personality. And that takes a while. It takes a relationship of trust. It takes the capacity of collaboration between two individuals that become a unique team to try to understand and change very deep set patterns. We have a vast literature on different kinds of ways of experiencing the world and what the implications are for a therapeutic relationship. Even on such a simple matter as whether the therapist moves in to sit closer to the patient or gives the patient a lot of space. More depressive people feel better when you do the former. More schizoid people feel intruded on when you do that, and they much prefer having space. So even simple things like that are important for therapists to know. Therapists who get taught about nothing but specific symptom syndromes and what treatments have been found in some statistical majority of patients to be helpful don't have nearly the repertoire of understanding of how to make a therapeutic relationship as people who've been trained in individual differences. I've had a lot of therapists come to me. I do a lot of supervision and consultation over the years, saying, I got a lot of training about how to apply different techniques, but I didn't get training in the differences among individuals that I would be applying the techniques to. And I'm learning through hard experience that it makes a huge difference. So, for example, somebody will read the literature on self-disclosure and find that in general the therapist saying something personal about the self, statistically speaking, gets a good response from most patients. But if you do that with somebody who's narcissistic, they will feel resentful, as if, why are you talking about you? Why aren't you listening to me? And it will make the therapy worse, not better. So there are numerous instances like that. With paranoid people, you don't want to be as warm as you are with other patients, because they wonder why you're being so warm. What's your hidden agenda? Why are you trying to seduce them? Whereas if you're warm with a person who's depressive, they think, oh, finally I'm talking to a person that has a real feeling for me. Those differences matter enormously, and we need to put more emphasis on them. I advise young therapists to go as deeply as possible into their own knowledge of themselves via psychotherapy, but also via reading about personality differences, finding supervisors that know how to talk this language. If you work with people with severe personality disorders, there's no surviving it without a lot of consultation and help from colleagues, because you get pulled into the painful affects, the painful feelings of people who live in these difficult psychologies, whether it's paranoid or borderline or narcissistic. You need a lot of consultation ongoingly. I have been practicing 40 years or more now, and I still talk to colleagues regularly about the difficulties of the work. I am extremely grateful for my having worked on my own personality in my own psychoanalysis. It not only helped me understand myself and find places in myself of borderline stuff, obsessive stuff, schizoid stuff, paranoid stuff, so that I had a greater range of empathy, it also gave me the deep in my bones conviction of how helpful psychotherapy is, how much of a difference it makes for people, so that when I'm sitting with somebody who's been trying all kinds of things to improve their life and has now become demoralized and despairing of really getting help, I have to carry the hope for the two of us for a while. I have to have confidence that this works. And that's where I got it from, my own experience in psychotherapy. My life is radically different from what it would have been if I hadn't had good psychotherapy. The DSM describes differences in personality based on traits. If you have a paranoid personality, you're suspicious and distrustful, for example. Those are traits. That's not wrong, but it misses the fact that it's the theme that organizes the paranoid person. The theme of paranoia is trust versus distrust. And paranoid people can be pathologically over-trusting, not just pathologically under-trusting. There are a lot of paranoid people that feel that their cult leader or their idealized political leader is perfect. That's being pathologically over-trusting. In obsessive people, they have the trait of neatness, but that misses the theme of control, discontrol, neatness, messiness. Most obsessive compulsive people I've ever worked with have a terrible mess somewhere that coexists with all these efforts to be neat. People with hysterical psychologies are sometimes very seductive and sometimes very prudish. So the trait of seductiveness misses the dynamic of a theme about sexuality, gender, and power. Schizoid people are famous for the trait of withdrawal, but they will sometimes have moments of exquisite connection with other people from which they then flee. So even the way we try to describe people based on traits in our taxonomies misses the internal experience of what it's like to see the world a certain way, to see the world as defined by who do you trust or not, or as defined by whether you're in control or not, or as defined by gender and power, or as defined by closeness and distance. And there are other themes for the other personalities. And we don't go near that in our descriptions. But for a therapist, you have to have a feel for that. And there are other ways of thinking about individual differences that take those internal experiences more into consideration. I know you've done a lot of work with people with borderline psychologies. You can't really describe borderline psychologies very well without a feeling for the terrible preoccupation with whether you're connected or disconnected, and the terrible anxiety if you feel rejected, and the terrible feeling of being controlled if you feel too connected. Those are internal experiences that are important to understand, or else you won't understand the way the person with borderline psychology behaves. They'll complain for years about their horrible partner, and you help them separate from the partner, and then they get free and they go into abandonment terror. So if you don't understand that, you're working toward a goal that you don't fully understand. You don't know what to make of it when that doesn't help the person, and you decide, okay, this kind of person isn't amenable to treatment, so now I'll throw them out of treatment. You really need to understand what their internal experience is like to understand what the nature of treatment is. Up up until about 1980, when the Diagnostic and Statistical Manual of the American Psychiatric Association made a major paradigm change. It was personality that preoccupied most clinical writing. Individual differences, like whether you were more hysterical, obsessional, paranoid, narcissistic, schizoid. There were many different sort of organizations of personality on which there was a fairly large clinical literature and in some cases a significant empirical literature. And those literatures were very helpful to therapists because an anxiety disorder in a person with a hysterical psychology looks different and responds to a different kind of therapeutic style than an anxiety disorder in an obsessional person, for example. But in DSM-3 and since then, personality disorders were first of all kind of an afterthought. They were literally relegated to the back of the book because that manual was more interested in describing specific syndromes, especially depressive and anxiety syndromes, but also eating disorders, addictions, and other problems. And the personality in which those occurred were somewhat minimized. I guess I would love to have known how powerful the emotional experience is of really getting inside another person's sense of the world. I don't think people who are not therapists have any sense of how exhausting it is to let yourself feel all the toxic emotions that come at you from people who suffer a lot. I would probably try to prepare myself for that and also give myself some advice to be sure that I had places in life that were free of that. You can't be in that space all the time. You have to have friends completely outside the psychotherapy network or some hobby or interest that nourishes you. There's an awful lot of exhaustion from doing the work. I would certainly encourage myself as a young person to get a lot of group supervision, to take advantage of listening to other people's struggles with their patients. And I would put much less emphasis on theoretical orientation and more on experience. You can learn from people of any theoretical orientation. We're all looking at the same suffering animal. We have different languages for what we are describing, but experienced therapists tend to work rather more similarly than new therapists of very different theoretical orientations. So the more range you have in the people that influence you, the more you can learn from people of different orientations, the better, I think.